Hello and welcome. If you are looking to purchase instrument cassettes, good for you. Cassettes are the safest and most efficient way to organize, store, and reprocess your instrument. Here's why. Cassettes will keep all the instruments locked together for each procedure to ensure that you never have to leave the room to find a missing instrument. Cassettes will increase the life expectancy of your instruments by preventing the dulling of blades and the scratching of the mirror lens. The reason why is without cassettes, we're going ahead and dumping several different instrument setups into that ultrasonic cleaner where they're going to jangle together. Then we're going to rinse and dump them all onto a towel. And that's where our blades get dull and the mirror lenses will scratch. A cassette will hold the instruments in the order of use, making it efficient for retrieving and replacement while performing the procedure. And did you know that OSHA and the CDC recommend using cassettes due to the reduce of risk of a potential exposure during reprocessing? Cassettes will save you time during pouching and reprocessing as well. So we understand why cassettes are the best choice for instrument management, but how do we decide which style to purchase? Before we decide this, let's explore 4 key factors to ensure that the cassettes you choose are going to accommodate your needs and space. First, obviously, we're going to count the number of instruments that you have for each procedure. This will determine the size cassette you will need for each. Then consider the number of setups that are required. Rule of thumb, I like to have enough instrument setups to get me through about a half a day, since the instruments get reprocessed throughout the day. Make sure you settle on cassettes that are going to accommodate every procedure you perform in your practice. Secondly, decide where we're going to store these cassettes and what is the required space that it's going to need. For convenience and ease of access, I recommend keeping the cassettes in cabinetry on the clean side of central sterilization. This allows you to put the cassettes away as they come out of the autoclave, and it gives the team members access to any of the cassettes for any procedure at any time. Third, we want to consider that cassettes are going to take up more room in the ultrasonic cleaner or the instrument washer, as well as the autoclave, than what the traditionally pouched instrument setups take. You can see that by the comparison at the bottom of the screen. That is an 8-place instrument cassette versus a pouched instrument setup of 8 instruments. Fourth, anytime we decide that we want to make a change or an investment in our clinical processes, we should take a moment to reflect on what is the purpose of this change. If we're looking at cassettes, it's usually because we want to improve efficiency and safety. With that said, are there other areas of the clinic where we could improve our clinical workflow processes or our material management? Now would be a good time to think about that. For example, if we want to look at adopting a color code system, studies have shown that color coding by procedure offers a visual element for quickly identifying and accessing everything required for each procedure. In other words, all the instruments and materials are going to be assigned a different color for each procedure. And then we're going to store those instrument materials in organizational products that can accommodate this. So for example, composite could be identified as blue, hygiene as purple, oral surgery as green, and so forth. When choosing cassettes, you may want to consider how they will work within a color code system such as this. So let's look at some options and break it down, just doing a little comparing of resin versus stainless steel. Both come in a variety of sizes to accommodate any instrument setup. Now, stainless steel oftentimes is referred to as metal, and resin is oftentimes referred to as plastic. So just wanted to kind of clear the air on that before I continued. So stainless steel cassettes have a removable cover, so you're going to take that cover off and set it aside. It has silicone rails that hold the instruments in place during reprocessing, and some cassettes have an accessory compartment, such as this, that you can hold extra instruments or burr holders. The stainless cassette has a slotted hinge that allows the cover to attach to the base of the cassette. It also has that stainless steel locking mechanism to lock that cover on. And it is autoclavable. Now, resin cassettes have an open design concept with rounded holes and rounded corners to allow for excellent water flow and effective cleaning throughout the washing process. The covers stay attached to this cassette by simply rolling back in an open position. There is a clip on the side of the cassette for convenient air, water, syringe tip storage. But if you don't use autoclavable syringe tips, you can simply remove that clip and discard of it. The resin cassette has non-slip feet, so when it's on your working surface, it's not going to be sliding around. It's made out of a glass fiber-filled resin for durability. So when we say plastic, it's not just plastic. It's got that extra glass-filled fiber to make it much stronger and last a lot longer. Some resin cassettes have an extra accessory compartment like you see here. This is perfect for storing die-cal applicators, Tafelmeyer retainers, sectional rings, or extra instruments. The silicone feet will lock the instruments in place, and it is available in many colors if you choose to do color coding. And of course, this is also an autoclavable cassette. I would like to compare the weight, temperature, appearance, and durability of these cassettes. The first one is weight. So I took 2 5-place cassettes and just simply weighed them. The 5-place stainless steel cassette was 277 grams, also known as 9.77 ounces, if you're more into ounces than grams like I am. The resin cassette at the 5-place cassette is 84.5 grams or 2.96 ounces. So doing the math, the resin is approximately 70% lighter than stainless. The temperature of the cassette after autoclaving, the stainless steel, obviously because it's metal, is going to retain its heat. So there needs to be a cooling time before the cassettes can be used. Whereas resin is much cooler to the touch right out of the autoclave, which eliminates having to wait to use this cassette. And as far as appearance of the cassettes, the resin cassettes, it has the extensive color options to complement any decor, procedure, or preference. It has a modern, compact design. It's visually colorful, which could be pleasing for the patient experience. When using a resin cassette, we don't have the noise of the instruments being passed back and forth and placed into that cassette. And after years of reprocessing, unfortunately, we will get some color fading or a little bit of discoloration. Stainless steel cassettes are stainless steel in color, obviously, and they have more of a clinical surgical appearance, which sometimes is not as visibly friendly with some patients as the colorful resin is. We'll have a little bit of clanging of the stainless steel instruments going into the cassette during treatment, which could be slightly irritating to the patient. And over time, just like the resin sort of fades in color, the metal oxidizes, it gets dull, and shows water spots. As far as durability goes, both stainless steel and resin are very durable, and they're made to last for many years. I would like to point out a couple of differences. The resin cassettes are more than just plastic, like I said before, with that fiber-filled resin. So there is that strength and durability there. But both have moving parts that may potentially break or wear out over time. However, in my experience as a stainless steel cassette former user, I've seen more issues with the stainless steel cassettes due to the complexity of the metal parts. As you know, all instruments and cassettes must be either pouched or wrapped before going into the autoclave. So both the metal and resin cassettes can either be pouched or wrapped. However, metal cassettes are more likely to puncture through the pouch because of the square-shaped corners. The other reason they're more likely is because they're a little bit deeper in depth. So when you go to place that cassette, it's easier for those sharp corners to catch that paper and either poke through or tear it. Where in comparison, the resin cassettes have the rounded corners that I showed you, and this is going to reduce that risk of poking through the pouch, and they slide in just a lot easier. We all know that it's faster and easier to pouch than it is to wrap. Simply place the cassette in the pouch, remove the strip for the adhesive, and fold the end to adhere it. Where wrapping requires a little bit more work. It's going to require autoclave wrapping paper, heat indicating tape for the outside of the package, heat indicating tape, or cards, for the inside of the package, and they must be labeled on the outside so the user knows what procedural instruments are inside that package. Whereas with the pouch, it allows you to see through the plastic side the color-coded cassette, so at a glance you know exactly what procedure it's for. We should be mindful of the cost of pouches versus wrap itself. So to do this, I selected just a dealer brand, and I compared the same dealer brand pouch against their wrap. And I utilized a 8 instrument cassette to determine what size I was going to be looking at. So for a pouch, it is about a 7.5-inch pouch, which is about 18 cents per pouch itself. Whereas the paper, it would require about a 12 by 12 inch paper, or wrap, I should say. So the dealer brand 12 by 12 paper is about 22 cents per use. Now you also have to take into consideration the cost of the heat indicator tape and cards, as well as the time it takes to go ahead and label those as well. So as you can see, pouching is easier, more efficient, and you can see exactly what's inside. Also, having it being more affordable than autoclave paper and its adjuncts makes sense to me. Now, color coding by procedures. This is the most efficient way to color code. The color code systems have been proven to streamline workflow processes. It expedites onboarding and cross-training of our team. It improves efficiency with both room turnover and instrument reprocessing. Resin cassettes come in many colors, like I said, and they accommodate all procedures and individual preferences. They are made for color coding. Stainless steel cassettes also can be color coded. You can order different colored rails that the instruments set on, but they don't have as many color options to choose from. Since I believe that wrapping is the ideal method for sterilizing stainless steel, due to their shape and size, it doesn't prove to be as you might say, color code friendly as the resin cassettes. So now I want to talk a little bit about the ease of use between the two types of cassettes. So the resin cassettes, like I said, have those covers that stay attached to the cassette and easily roll back, so it's really quick and easy to open and close those. The silicone feet actually hold the instruments in place, even when the covers are open. If the cassette must be moved or tips over when open, the instruments will not fall out. This will prevent a potential injury from a sharp instrument and instruments falling out and getting mixed up. It has the rounded covers to prevent the sharp edges of instruments to poke out the end of the cassette. And again, as a metal cassette user, I know that this is an issue, and I've clipped off many probe tips or other instrument tips in the past. But this resin cassettes with that rounded edge eliminates the chance of injury or broken instruments. Whereas the metal cassettes have a removable cover, which could make it challenging to find a space to place them if you have a limited workspace. To place the cover, you must carefully align the tab on the cassette into the slot, which can take a little bit of getting used to. The locking mechanisms must be accurately aligned to open and close the cassette. And if the instruments are not placed correctly, like I said, those tips are easy to hang out over the edge and oftentimes are reported to break in the closing process. Or, worse yet, If somebody doesn't realize the instrument is sticking out, it could be a potential injury and exposure. Finally, we're going to get to price. On average, stainless steel cassettes can be up to 70% more expensive than resin cassettes. For example, this 5-place stainless steel cassette on average retails for about $124. Compared to the resin cassette of the same size, it's average around $34. So this is a savings of $90 per cassette, or a 72% savings. So think about that. If you're going to outfit your entire office with cassettes, all of your procedures, all of the different setups that you need, that's going to be a significant cost savings. So in conclusion, due to the following features, because of the compact open concept for superior cleaning, the silicone feet that secure the instruments, because of the quick cooling feature and the ability to color code and pouch for efficient reprocessing and easy identification, the ease of use because of the attached rolling back covers, I would personally choose the resin cassette over stainless steel. Now, add in the significant price savings, and for me, it's a no-brainer. No matter what you choose, it is evident that putting your instruments into cassettes is the clear choice. Sorting and pouching contaminated instruments are dangerous because of the risk of a potential injury and exposure. It's inefficient due to the time it takes and the fact that instruments can get mixed up, creating setups with missing or duplicated instruments. And for me, honestly, it's just not very appealing. Thank you. I hope this helps.